So this is chapter 27, which starts on page 549 in your text. This is Hematologic and Lymphatic System Function, Assessment and Therapeutic Measures. In ATI, this is chapters 34 and 35. In this chapter, we're going to go over the components of the hematologic and lymphatic system, and then briefly review the sequence of blood clotting, because we've already gone over that pretty much in detail in your pharmacology class. We're also going to talk about how changes in the hematologic and lymph systems manifest as disease processes, and then we'll also, like always, talk about data collection, labs, diagnostic tests, and nursing care, therapeutic interventions, and that kind of thing as well. So first, the hematologic system. This is composed of bone marrow, blood, and components. The main function of the blood is to transport oxygen, nutrients, and then also cellular waste products. Blood also works to regulate body temperature, pH, fluid balance as well, and transport cells that also offer the body protection. And then the human body holds about 4 to 6 liters of blood. So first, plasma. So plasma is about 90% water and is the transport medium for nutrients, waste products, hormones, electrolytes, enzymes, as well as gases. Plasma also plays a role in clotting and immune function as well. Some of the plasma proteins are clotting factors, globulin and fibrin. These proteins circulate in the plasma until they're activated. And as the plasma passes through active organs like the liver and skeletal muscle, the water in the plasma is heated up, and then the heat is distributed throughout the body as the blood circulates, which will help to regulate body temperature. And then there are chemical buffers in the blood which prevent sudden fluctuations in pH, so that's how it'll work at helping with maintaining pH levels. So red blood cells carry oxygen that is bonded to iron and hemoglobin. The amount of hemoglobin in the red blood cell, or the amount of iron in the hemoglobin, or the number of red blood cells altogether can all play a factor in how much oxygen the blood can carry. If any of these are lacking in any way, it can cause anemia, which could result in symptoms like shortness of breath, wheezing, fatigue, that kind of thing. The life cycle of a red blood cell is about 120 days. Diseases such as malaria or sickle cell can actually cause the destruction of the red blood cells to happen at a much faster rate. Each person has a specific blood type that is hereditary. The ABO type indicates the antigen present or not present in the case of somebody who has O, type O blood. And then the RH factor, whether that's positive or negative, is referring to the presence or absence of D antigen. There's a table in your book. It's table 27.2. It's on page 551, and it explains the ABO and RH factors in a little bit more detail if you want to check that out. Alright, so white blood cells. Monocytes become macrophages, which phagocytize pathogens and dead tissue. The neutrophils phagocytize only pathogens. Eosinophils will combat the effects of histamines, and then also detoxify foreign proteins during an allergic reaction. And then they can also respond to parasitic types of infections. The basophils release histamine as part of the inflammatory response. And then there are two types of lymphocytes, the T cells and the B cells. The T cells, if you remember, can be helper cells or suppressor cells or killer cells, and then they can also be memory cells as well. The B cells become plasma cells, which produce antibodies to foreign antigens, and then they can also become memory cells as well. So platelets are involved in all the mechanisms of hemostasis or clotting. When injury occurs to the vein, then it will cause the platelets will cause the vein to spasm or constrict by releasing serotonin. Platelets become very sticky and they adhere to rough edges and to one another, forming a platelet plug, which stops the bleeding. Platelets will produce factors that, when released, can stimulate the chemical clotting cascade. So platelet factors, clotting factors, and thromboplastin react to the prothrombinase. And then prothrombinase converts to prothrombin, converts the prothrombin to thrombin, and then thrombin converts soluble fibrinogen, which then forms a clot. So the lymphatic system
Alright, there we go. Sorry about that. Got myself a little discombobulated there with my computer. Alright, so the lymph of lymphatic vessels, nodes, and nodules, the spleen and the thymus. The lymph system returns tissue fluid to maintain blood volume. It also protects the body against pathogens and other foreign materials. So here we are. Now we're on this slide. Alright, so the lymph capillaries are found in most tissue spaces. These capillaries, they come together or anastomose, forming larger lymph vessels. There are valves within the lymph vessels, just like within blood vessels, that will prevent backflow of the lymph fluids. Lymph from areas below the diaphragm and the upper left quadrant enter the thoracic duct, and then it's returned to the blood in the left subclavian vein. And then lymph from the upper right quadrant enters the right lymphatic duct and then is returned to the blood in the right subclavian vein. So that's the flow of the lymph. So nodes are masses of lymphatic tissue along the pathways of the lymph vessels. The nodes are both superficial, so some of them you can feel, and some of them are deep. They remove pathogens before the lymph is returned to the blood. The major paired groups of these are cervical, axillary, and then inguinal nodes. Nodules are small masses of lymphatic tissue that are just beneath the epithelium of all mucous membranes. Most of the lymph nodules do not have names, but an example of lymph nodules would be the tonsils. Lymph nodules destroy pathogens that are or that may penetrate the epithelium. So the spleen is located in the left upper quadrant just below the diaphragm, and it's protected by the rib cage. The spleen contains both B and T cells, which conduct immune responses. And it also contains macrophages, which, again, can phagocytize pathogens, and they can also phagocytize defective blood cells and platelets. The spleen also stores about 1/3 of the body's platelets. So if something happens here, there can be a pretty good sizable blood loss. The thymus is located just inferior to the thyroid gland, so below it, and then anterior to the trachea, so in front of it. The thymus contains T lymphocytes, or T cells that mature and proliferate, and then thymic hormones contribute to the maturation of these T cells. So as people age, their immune response becomes less efficient. Excuse me. So they are at an increased risk for infection. They are at risk for anemia related to iron deficiencies and also a slowed erythrocyte production. And they also have a reduced plasma volume, which puts them at risk for, or an increased risk for dehydration. So we want to gather a really complete history. We want to know, why are they here? Why are they seeking care? What is their family history? What is their diet and intake like? What are their fluid intake like? What types of medications do they take? Do they have any occupational exposures or other types of exposures that we need to worry about? they have a recent history of fatigue? Do they have any bleeding tendencies? Like, have they been having lots of nosebleeds? Are they having bloody or black bowel movements? Are they having any types of skin changes or signs of bleeding in the skin? Like, are they having any petechiae, which are these small, almost pinpoint purplish spots that are under the skin? Or ecchymosis, which are larger bruises or larger areas where you can see blood under the skin? Or purpura, which is like larger, I would say, petechiae, or lots of petechiae kind of squeezed together. Any respiratory symptoms? Are they feeling short of breath? And then any lymphadenopathy, or are they having any swelling in their lymph nodes? Again, the what's up mnemonic might be helpful in collecting a history. So we want to collect vital signs. Are they having any fevers? This might indicate infection or something like that. What is their level of consciousness? They can have decreased levels of consciousness if they have hypoxia or fever or any kind of bleed in their brain or something like that. How is their skin color? Is it pink, normal, cyanotic? Is it gray tinged? What does it look like? Do they have any signs of bleeding, so any bruising, or is their skin pale, so do they look like they're anemic? Again, with their lymph nodes, is there any swelling? I want to take a look at their fingernails. So striations or spoon-shaped type of nails can indicate anemia. If they have clubbed fingers, this could indicate long-term hypoxia and anemia as well. I want to take a look at their abdomen. Is there any ascites or swelling, any increased abdominal girth? This can again indicate bleeding or ascites as well. So examples of routine blood tests are complete blood count or CBC, also H&H or hematocrit and hemoglobin, and then also platelet levels. Coagulation tests would be PT, INR, or PTT. They can also check thrombin clotting times, and then blood typing and cross-matching will be done as well. Bone marrow biopsy is usually done at the iliac crest, but could be done at the sternum or spinous processes in the vertebrae. Bone marrow samples, when they are collected, are usually used to diagnose like hematological disorders, or they also may be used to monitor treatment. This type of procedure can be really, really painful, so we want to make sure that there's an order for pain medications and that we administer them before the procedure happens. In the lymph angiography, a blue dye is injected into the lymphatic vessels, and then various x-rays are taken to look at the lymph flow to see if there are any blockages or just to see how the flow is going. The dye that is injected into the lymph system through the hands or the feet, so that limb will need to be monitored for CSM after the procedure. We also want to look for any types of signs and symptoms of bleeding as well. The patient also needs to be advised that their urine, skin, and stool may be blue tinged from the dye for about 2 days. So that would be an important thing to kind of let them know. And then just like biopsy of any other system, biopsy for the lymph system is usually done to these persistent swollen lymph nodes, and it's used to determine whether the problem is just an infection or if it's a malignancy or cancer. For this procedure, we want to teach the patients signs and symptoms of bleeding and also infection so that they know what should be reported to their physician. So I think I skipped a slide again here. Let me go back one. Here we go. Sorry about that. All right, so there are lots of different blood products that can be infused. So this is just a list of some of the components that could be ordered for a transfusion. So the doctor might order packed red blood cells or frozen red blood cells, platelets, albumin, fresh frozen plasma, or cryoprecipitates. There's a really great table in your book. It's on the top right-hand corner of page 557. It's table 27.6. And it lists each one of these different products and their use as well. So you might want to take a quick gander at that. All right, so transfusion safety steps. So it's
You know, the goal to administration of any of these products is to do it safely and to avoid any types of mistakes which could actually potentially be fatal to the patient. So that's why making sure that there are a lot of steps in place to ensure safety is really, really important. So we're going to do a really good assessment. We want to get baseline vital signs. And then we want to know if they have had any recent transfusions, if they've had any history of transfusion reactions. Because if they have, we may need to do some pre-medicating before they actually get the transfusion to ensure that they don't have any problems. Identification is probably the biggest thing that we can do to ensure that there are no problems for the patient. We want to make sure that they get the right product. So this is huge. There are several redundant steps to ensure that the right blood gets to the right person. Remembering that if an error is made, the result can be fatal. So here, there are absolutely, positively no shortcuts ever, 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 because we can certainly kill somebody if we don't do the right things. And with identification, it starts with the lab, where the lab is doing multiple checks, where 2 people will check it twice in the lab to make sure that you have the right blood, and then when you get to the bedside, you're going to be checking it again with 2 nurses, whether those are registered nurses or licensed vocational nurses. 2 nurses will need to check the product and check the patient identity, comparing the bag to the patient's name band. We also ask the patient their name and date of birth as well. Other things that are done to help with transfusion safety are filtering. So the products, actually most of the blood administration tubing has a filter already built into it. And this is just to ensure that harmful particles that are within the blood don't enter the patient. Your book refers to something called washing, but I've always heard it as leukocyte reduced. And what this does is it removes plasma, which can decrease the risk of a transfusion reaction. And then warming, especially if they're going to get blood in a rapid fashion, so they're going to have it infused very quickly, or they're going to be getting multiple units, we want to make sure to warm it because we want to avoid hypothermia. So some of the reactions that can happen, febrile reaction, this is the most common. It's important to get baseline temperature and to monitor vital signs frequently, and that's why we're monitoring them very frequently to see if they're having increased in temperature. Some of the signs and symptoms would be fever or chills, shaking. They might also complain of a headache and a backache. And here usually, well, with all of the reactions that we're going to talk about, the blood is stopped, but here also they might give Tylenol to help with the fever. With the urticarial reaction, this is hives. It's considered a minor reaction again. We're going to stop the transfusion, and then usually Benadryl will be given. Hemolytic reactions, this is the most deadly, and this causes hemolysis of the red blood cells. Again, we're going to stop the transfusion. That's going to be huge. Signs and symptoms can be backache, chest pain, chills, fever, shortness of breath, nausea, and vomiting. The patient might also tell you that they have just this general feeling of impending doom. As things progress, they'll have signs of shock. They'll have hypotension, oliguria, decreased level of consciousness as well. Here we're going to give fluids to decrease shock and hypotension, and then diuretics are given to promote urine flow. They may also need dialysis because the kidneys are most likely the organs that will be damaged. Anaphylaxis, this is a severe allergic reaction that can cause respiratory and cardiovascular collapse. They may experience this severe gastrointestinal or abdominal cramping, like instantly they'll start vomiting, uncontrolled diarrhea. And here you may need to start CPR. Steroids will be given, oxygen, Benadryl, epi. Other medications may also be given to support the patient. They may need to be intubated. This is a pretty severe reaction, although it's a little bit less likely. You know, it's not as common. It does happen, but it's not as common. And then circulatory overload happens when there's a rapid transfusion of blood products over a short period of time. Elderly people are a little bit more susceptible to this, or anybody that has any type of circulatory compromise. So like folks with congestive heart failure, it would be important to know that. So something you might want to know in their history, or if they have had any problems with this in the past. So signs and symptoms would be chest pain, cough, a frothy type of sputum, jugular vein distension, crackles, increased heart rate, and here we're going to give diuretics. So remember, anytime there's any type of a reaction or you suspect a reaction, the first thing that you're going to do is stop that transfusion immediately. And I think we have probably gone over that multiple times. But stop the transfusion, and then we're going to get help and then administer some medications to help the patient out. So that's it for this chapter. You can post any questions that you might have under the forum, under the questions section. Again, you can always email me, you can call me, you can text me. I'm happy to answer any questions. We'll also have time to talk about this chapter tomorrow during class. All right, thanks, and I hope you guys have a good night.